The World Health Organization is tracking new subvariants of COVID-19, known as Aries and Fornax, that have begun to spread in the US. Immunologist Prof Sibrandes Poppema breaks down the current status of the virus.
Basically, the virus is still there, probably never will go away, and the majority is still Omicron, so the same one we've had now for almost 2 years. But there's new variants indeed, and those variants are not more dangerous, but they are again a little bit more infectious than the previous ones. So they have all sorts of fancy names like Aries and so on. But basically, they are descendants of Omicron. So let's say there was Omicron, what we've had in the last period was called Arcturus, and these new ones are, just a little bit more infectious again.
Although no new symptoms have been observed from these variants, Poppema warns Malaysia could experience a rise in COVID-19 cases once again.
The winter wave will be in Europe and the US, and then it's probably a few months after that when it's coming here, because right now the world is open again. We travel everywhere. Many countries not wearing face masks at all. In Malaysia also less and less. So we are quite open to a new wave infection now.
U.S. President Joe Biden's administration plans to urge all Americans to receive a booster shot this autumn season. With a new wave of infections on the horizon, Professor Poppema said it would be wise for Malaysia to follow suit.
When we've had the disease, is good for about half a year, up to maximum 1 year of immunity. So if you want to be protected, it's wise to have another vaccination. Now, the question is, how many people should be vaccinated? Certainly people over 65, might consider people over 50, definitely people that are at risk, so people that have severe obesity, people that have lung conditions like COPD, people with hypertension. Those are the people that definitely, in my opinion, should be vaccinated again. There are new vaccines as well. A couple of companies have made new vaccines that are more specific, not for these latest variants, but the one before, so that's Arcturus. So Arcturus is, let's say, the son of Omicron. And for that one, they have created new vaccines that, as they say now, are also working for the newest variants.
Poppema added that the government must act now if it wishes to provide another vaccine rollout.
I think, this is the time where the government should consider, a decision on whether they want to provide vaccinations again, which groups they want to provide it to, and also how they can purchase the new vaccines, because they've just been produced, just been tested. They will come online in the next months, and I'm pretty sure that, again, it will not be so easy to lay our hands on sufficient doses. So this is something that needs to be done now.